Hello everyone. So today's topic is clinical features due to CSOM. So these are only the clinical features due to chronic suppurative otitis media directly. We are not discussing the clinical feature of the complication that will be discussed in another part. So most of the patients of CSOM are asymptomatic, means there is discharge, but that discharge is so scanty that patients sometimes do not notice it for a long time until the complications arise. So most of the patients are asymptomatic. The second thing is that some of the patient may notice the air discharge because that air discharge is foul smelling. Now the cause for this foul smelling air discharge is anaerobic infection. Anaerobic bacteria infect. There is actually a mixed infection, so due to anaerobic bacteria it is foul smelling. And the second thing is it is scanty because most of this discharge is because of the bony erosion that is occurring due to cholesteatoma. So this is because the bony erosion this is because of bony erosion, so it is scanty. The third thing is that there will be a hearing loss. Now it can be conductive or a mixed one. Now the conductive hearing loss is because cholesteatoma can itself block the middle ear. Means if this is our part of the middle ear and this is the external auditory canal, cholesteatoma can itself block the pathway, or otherwise it can cause ossicular necrosis. Okay, so this is the reason for conductive hearing loss. The next thing is uh, the conductive hearing loss plus sensory neural hearing loss. This is because cholesteatoma can cause damage within the inner ear that will lead to a conductive plus sensory neural hearing loss known as mixed type. So what we will see on examination on otoscope is that we may see a perforation within the tympanic membrane. Okay, this will be the tympanic membrane and this is the handle of Malleus and lateral process. So we may see a perforation in tympanic membrane, and this perforation, this is left side of tympanic membrane, as you may see in the left tilt. So there will be a posterior superior perforation, and this perforation will be marginal. Okay, the second thing which we may see in the otoscopy or microscopy is that there are retraction pockets within the attic. Okay, this we have already discussed. And the third thing is we may see a cholesteatoma. So these are three things which we see on examination. Now the most important thing we need to remember is that there may be a polyp, a red fleshy mass that we are seeing. And whenever there is a remember this thing, whenever there is a red fleshy mass, a red fleshy polyp within the air with a chronic otorrhea, okay, then cholesteatoma is considered the diagnosis until proven otherwise. So whenever watch this image, we are seeing a red fleshy mass, not so clear, but polyp coming out of the we are seeing through external auditory canal. So whenever there is a polyp plus a chronic otorrhea, cholesteatoma is diagnosis until proven otherwise. Thanks for watching.